a lot of people see challenges in their workplace, and especially in an NHS hospital setting, and find that, or I wish this was better or this was better, but they don't actually do it. What motivated you to actually take the step to try and solve it?
I've been practicing for at least 8 years in the NHS. I still practice as a clinician, as well as my role at Asuric, which we'll come on to. But yeah, it goes back to medical school. I was always interested in quality improvement and sort of trying to change things. And that when I got my first taste of digital health innovation. So I've thought it's bizarre that switchboards and bleeps existed when I was sort of tasked as a medical student to try and call someone, and had to call the switchboard and wait for ages, and then and the whole system I thought was completely ludicrous. But obviously, to people in the system, it's what they're used to. So that's when I kind of started working on an initial innovation in the form of a phonebook app. But this is when everyone was having smartphones now, back in 2015. This was so a very simple app of a phone book on your phone where you could look up the number you needed, as opposed to going through switchboard to try and access it, which a lot of clinicians listening will sort of probably have used Induction app, which is very similar. And at the time, that kind of gave me that first taste. But I very much saw it as a kind of small project and didn't want to take it more than that. And then clinical work took over. But that was the first point I thought, oh yeah, this could actually make a difference. Just fallen into the same trap of being frustrated as a clinician, wanting to change things. Even at one point, I wrote an email. This was back when I was doing my foundation years, and I wrote an email to Cerner and the EHR provider, and also sort of leads at Imperial, where I was, regarding lots of user feedback as to how the product could be changed to make it more efficient and easier to use. And I thought this would go somewhere, but of course it didn't, and I didn't even get a reply. But it made me feel a bit powerless to change things, especially from within. And of course, I was working clinically, and that kind of was my main priority, and that took up a lot of my time and energy. But it was actually taking a step back and leaving full-time clinical work. So I did my internal medicine training 3 years, and then after that, I didn't feel ready to go straight into specialist training. I felt for me, there would have been a huge opportunity cost, because I'd always wanted to try something new, learn more about AI, innovation, digital health, see if I could make an impact that way. And it was actually once stepping out of the full-time clinical work that I could, and alongside skilling up in things like AI and technology, that gave me the confidence to realize that I could actually potentially build something that had quite a large impact. And that's what motivated me.